In the emergency department, we as nurses see many patients who have been identified as needing more help at home than they were previously given or provided. Providers, nurses, case managers, social workers, psychologists, therapists, specialized teams, home health care teams, and many other members all come together to provide the best quality care for each and every patient. The specific model that my practicum setting may be seen to use is the Naylor model. The Naylor model emphasizes identifying patients' health goals, designing and implementing a streamlined care plan, and continuity of care across settings and between providers throughout episodes of acute illness. This model focuses on genuinely listening to the patient, the family member, and other patient advocates as to what this specific patient needs. If I were to implement one particular model into the practicum setting that I am currently at, I would choose to include the model of GRACE. The Geriatric Resources for Assessment and Care of Elders, also known as GRACE, was created by the University of Indiana School of Medicine by researchers as a model of care developed and collaborated with primary care physicians. It focuses on assisting low-income geriatric patients who have had multiple medical comorbidities to get optimum health, increase their functional status, decrease unnecessary health services, and prevention of placement in long-term care facilities. My practicum site serves hundreds of low-income older adults who would benefit significantly from a model such as this. Both of these models use many elements of case management. Patients come in and see providers and are provided care by nurses, techs, and many other healthcare staff members. These patients are then quickly identified as needing more care at home, and case management and social workers step in. Each patient is different and has different goals that they have identified. When designing and implementing care for these patients, a streamlined care plan has been proven to be the most effective and efficient. Creating and collaborating with the providers focuses on helping these patients with their multiple medical issues to get the optimum health for the most economically reasonable price when developed. Research states that after the care manager and team analyzes the results of multiple assessments and determines the customer's strengths, interests, abilities, and potential areas for further development, the case manager and team, as well as the customer, work together to develop a plan of care for that patient. This, therefore, agrees with and supports the use of these two described models.